Oh, good morning, everyone. Happy Saturday. I am Dr. Malea Jensen. Welcome to Dr. J's Prescription for Health. In case you're new here, this is your reminder to, click the subscribe button, hit the thumbs up, do the thing. We are waiting for everybody to jump on. Good morning, Diane. I appreciate you being here. Good morning, Instagrammers. And good morning, YouTubers. Good morning, all together center stagers. Welcome. We'll wait a bit here for everybody to jump on. I don't know how long it takes that for YouTube, but it looks like people are starting to get notified on Instagram. I'd like to start out today talking a little bit about carnivore. January is known for being carnivore month. Maybe it's in some sort of retaliation, but it gives me reason to discuss it and maybe to get you guys' ideas, what you think of carnivore and what are the benefits. You'll have to excuse me. I was rushing around this morning getting back from the gym, so still got a wet head from showering, but it's better than having greasy hair, I suppose. But anyway, that is the deal today. We're in a bit of a rush, but I'm glad you guys are here. Let's start out by talking a little bit or asking a question. What do you guys think about carnivore? Why even consider it this month for 30 days? Or I guess it's a little short of 30 days. 31. Isn't there 31 days in January? Yes. So we're sitting at around 28 days of where we could maybe try carnivore if you haven't already. What are the benefits? You guys can go ahead and shoot me some benefits that you have seen if you're carnivore, but weight loss is a big one. And weight loss without starvation is even more important. The word starvation has many connotations, and I would like to say that I think we get it wrong. When we use that word starvation or I'm starving, it doesn't necessarily connotate that you are without food. The only time that you can actually be in starvation, and you know how I like definitions, is when you no longer have the ability to use your own fatty acids, meaning they are gone, okay? You are now in a state of starvation because you can no longer make ketones. You no longer have fat on your body. So as long as you have fat on your body to have fatty acids to make ketones, you're not starving. You might think you're starving, but you are not starving. But more importantly, when we start a carnivore diet, if we're doing it correctly, and is there a correct way to do it? Another definition, I would say that you get weight loss without being hungry because protein and fat are satiating, naturally satiating. So you're not going to find yourself in this, in a position where you're barely making it meal to meal and you're starving or you're so hungry. Okay. In fact, I have had carnivore or ketogenic people tell me that they've eaten more than they've ever eaten and feel great. So again, that goes back to the fact that a carnivore diet or an animal-based ketogenic diet is helping people in so many ways. And another reason to think about carnivore this month is it lowers inflammation. The very fact that being on a ketogenic diet produces ketones are naturally anti-inflammatory. And with that being said, autoimmune disorders are less. Joint aches and pains are less. Heart disease, less. Diabetes, less, obviously. So lowering inflammation is a big one. And I, for one, if you guys have a question, just put it in front of your, it's hard for me to continue to read all the comments, but if you have a question, just put a question mark in front of where you're at, and I will try to read all the questions. We're waiting for our moderators to jump on board here. Hopefully they'll be here soon, and they help me out to get your questions answered faster. You can always do a super chat, and that usually helps me to run this channel. So I do appreciate that. Where in my journey with carnivore has it helped me the most? I would say the inflammation component has been the best. I used to gauge, basically how I felt day to day was how badly my shoulders were hurting me. And the ache usually goes away. It's not something that I would sustain all day long, but just waking up in the morning with sore shoulders was enough to, gauge and let me know how the day was going to be or how I slept. And usually when the shoulders hurt, it wasn't so good. When I went on a carnivore/ketovore diet, the pain in my shoulders miraculously resolved. And over the last 3 years, I've actually kind of played with it a bit and added, say you go out to eat and do something. And I was just actually talking to one of my chiropractor friends about this, is over New Year's, I went out to eat with my mom and we had pizza. And that played havoc on not only my shoulders, but my gut. And it's something that tells you that I don't think I really want to ever do that again. Do I think I will? Probably, for those occasions when I go out to eat or something like that. But I know the repercussions. And yes, the gauge on my shoulder pain is real. So where have you guys noticed it when you have gone, ketovore or ketogenic? Ketogenic diet is either keto, ketovore, carnivore, lion diet. Those are all ketogenic diets where the result is using fatty acids to make ketones to use for an energy source rather than glucose. You're using some glucose, don't get me wrong, but the majority is using ketones as an energy source to fuel the mitochondria, to get them going. Also, carnivore, another benefit is diabetes, insulin resistance, high blood pressure, hypothyroidism. About any chronic disease that you can think of, carnivore has been shown improvement in all of these things. So let me know, is that you? Did you have insulin resistance or diabetes? Did you have high blood pressure? You're on all these medications and all of a sudden you go carnivore and 3-4 months down the road, you are off your medicines and you no longer have a diagnosis of diabetes? I mean, these are real things. What are your experiences with it? What about reducing gut irritation? This is a big one because I believe gut irritation, gut inflammation is the cause of a lot of our inflammation, a lot of our skin conditions, a lot of our irritable bowel and our Crohn's and our ulcerative colitis. When we reduce gut irritation, we improve. Most gut problems are due to the things that we're eating, lectins and grains with gluten in it. The lectins, actually the agglutinin from wheat increases a molecule called zonulin. And you can check for zonulin. I've checked people for zonulin because I want to actually prove to them that their gut is inflamed, which they already know. But I like to check a zonulin level now, have them go on an elimination diet, and then check their zonulin level after. And it is eye-opening for people. Sometimes just the lack of symptoms or the resolution of their symptoms is enough to convince them that what they were eating, a plant, was the cause of their gut irritation. So what zonulin does is it actually increases gap junctions in the cells of the lining of our gut. They're supposed to be real tight. They're called tight junctions. But when our gut gets irritated, gets inflamed, zonulin is produced, and zonulin actually causes junctions to form between those endothelial or enterocytes, between the cells. And so those gap junctions is a lot of cause of inflammation, and things from the inside get to the outside. And then you have problems with the irritable bowels, the Crohn's, the ulcerative colitis. It's the foods that we're consuming, you guys. So there's nothing really magical sometimes about a carnivore diet as much as it's the eliminating of the things that were causing your problems. So is there magic in in animal foods, well, there's some magic. I mean, they're the most nutritionally dense food that you can eat. Animals, animal meats, they will heads and tails above any plant as far as nutrition is concerned. So these are the things that we need to keep in mind. I do believe that a carnivore diet supplies superior, hands down superior nutrient density, bioavailability, things plants do not have. They don't have heme iron. We need heme iron. They don't supply B12. They don't supply retinol, vitamin A. They don't supply zinc. They don't supply vitamin K2. There's a lot of things that plants don't give us. And I know that plant eaters will mix and match and do the thing. And I'm happy about that. At least they're in the, awareness phase where they know that they're not getting complete nutrition and they have to add things. A supplement, the fact that you have to supplement, however, tells me that your diet doesn't supply everything, that you are eating or consuming a diet that is nutritionally deplete, therefore needing supplements. Meat contains creatine, carnitine, carnosine, taurine. Do plants contain those? No. Carnivore diet will stabilize your blood sugar. We mentioned above that I've seen many people have resolution of their diabetes, their insulin resistance, their hypertension, their blood pressure problems, even thyroid problems. What about mental clarity? How many people out there on a carnivore or a ketogenic diet have resolution of their brain fog? They're just thinking clearly. They focus better. Well, once people finally get into ketosis, this is a great side effect. These are the benefits. I'm just going over the benefits of carnivore being, and if you guys, I'm sure you have probably some other experience being carnivore, what is done to you for you to help. But what is Dr. J's core principles of a good diet? Well, I believe that we, for one, need to eat real food. Nothing processed. Absolutely nothing processed. Okay? Processing is destruction of food, and it's not real food. It's fake food. Even some of the things that we think are real foods are not real foods. They've been bioengineered. They've been made in a lab. They've been developed in a lab. They've been sitting on trucks for months and months and months, and we consume them thinking that they are nutritional for us. But by the time we get them, to be perfectly honest, all the nutrients that you thought were in that particular food are not there. They're not there. They are of no benefit to you. They can be made to last on a truck for months or in a warehouse for months. Okay? And that is not good for you. There are no benefits. I think that we should choose nutrient-dense foods. This gets back to my belief in consuming ruminant meats. They are the most nutritionally dense foods. I believe we are apex predators. Ruminant meats are very important. What are those? They're polygastric animals. They are deer, sheep, lamb, bison, buffalo, cow. Those are the things. My top 10 foods probably ends at 3 or 4. Beef, coming from ruminant meats. Eggs, 100% bioavailable. Butter for the long chain fatty acids and a good food, a source of fat. That's 3. I might add in some sort of food for essential fatty acids like sardines. And I don't want to fail to mention that I consume organ meats as well. And I do that daily, whether it's 1 to 2 ounces of liver, but that is something that I have incorporated in my particular meal, whether it is carnivore or not. I am probably ketovore because I do consume dairy. Many people don't consume dairy. There's problems with dairy. I haven't noticed I've had a problem with dairy. I've eliminated it and went back on it, and I've never had a problem. So fat is essential. Getting it from sardines is one way to do that, along with vitamin A. Dietary fat, I believe, is not the cause of heart disease. And if you've read studies past 2016, you will know that there are more and more studies agreeing that saturated fat is not the cause of heart disease. And that's why we've kicked the can down the road and saying it's LDL. Oh, it's not LDL now, it's the LP little a. Oh, it's not LP little a, it's ApoB. I mean, it's just one more thing. But for me, fat is essential. Dietary fat that comes naturally with animals is vital. It's vital for absorbing fat-soluble vitamins like A, D, E, and K. I think it's important in my Dr. J's core dietary principles to eliminate all seed oils. All seed oils, I do not consume them. I think that seed oils, along with glucose, is a problem. You know, carbohydrates, elevated glucose is a problem as far as chronic diseases are concerned. So I think that avoidance of seed oils is very important. The seed oils are the 3 C's, the 3 S's, and rice bran. There's 8 of them. Cottonseed, canola, corn, safflower, sunflower, soy. Those are seed oils. I don't consume them. In fact, I don't consume any oils. Tallow, ghee, butter are the fats of choice. Happy New Year, Lion, to you as well. Thank you. Fiber. Is fiber on my core principle diet? Absolutely not. Fiber is a plant. It's indigestible. It blocks absorption of important things that I want, okay? My vitamins and minerals, my amino acids. There's a lot of cofactors that fiber tends to block. Now, if I was eating a standard American diet, absolutely, I probably want to consume fiber because it's going to help me out a little bit with all the crapola I've been consuming, but I gave up standard American diet many, many years ago. In my core dietary principles, I do not include plants, -1, and that would be coffee. I believe that plants are toxic. They have natural defense chemicals in them that I don't want, called phytotoxins. I believe that they are nutrient deficient. I think that the phytotoxins are great if you want to deter predators, but I don't want to be affected. Pick a plant and have these natural defense chemicals inside of me, okay? The toxins that are in plants, just to name a few, are oxalates and lectins and phytates. I mean, there's even cyanide in them. There's pesticides, there's glyphosate. I choose not to do plants. That's my core dietary principle, okay? I'm giving you Dr. J's core dietary principles. They might not be yours. I'm not telling you what to eat or not eat. I'm just giving you information, okay? You know, if you tell me that eating some carbs or is good for you, like fruit or vegetables, I will tell you that even what you consider healthy sources, like fruit or whole grains, are not healthy. And can fuel the very things that you're trying to avoid, like addiction and hunger. So again, I avoid those things. If I know what a trigger is, I'm going to avoid that trigger. You know, fruits and vegetables today are bred for sugar, basically. The things that we are consuming now are made in a lab. They are not real. Okay, you can argue all you want, and and tell me that it's got these vitamins, and they're gone. The vitamins and the nutrients, they're gone by the time the coloring is fake, the sugar is fake, everything about it is fake. And so, RM, I'm glad to see that you're here. I'm doing a little bit of education since this is January and it is carnivore month, and I went over some benefits of carnivore diet, and now I'm talking a little bit about my Dr. J. I am a family practice physician. For those of you who do not know, I am located in Iowa. I've been practicing for 27 years. I am board certified in family medicine. Like I said, my core principles may not be what you want to do, and that's fine. But I think you should be knowledgeable about these things. Because these fruits and vegetables are bred for something to get you addicted, I've chosen to avoid them. Okay? There's not really, also, here's the thing. I consider us animals. We are mammals, and I believe that animals eat species specific. There's birds that eat only a certain type of berry, and if they eat another type of berry, they could die. If we eat all of this variety, with that, I believe, is where we're getting into problems. We believe that we can eat these things, that we were all of a sudden just evolutionary change, that we can consume these things, when really there's no animal in the wild that eats hundreds of different plant species. Why are we any different? Okay? Why are we any different? And you guys could argue with me, but this is just my thought process, okay? Finally, with my core principles, Dr. J's core principles, is I drink water only, with one minor exception, is a cup of coffee in the morning. Maybe my downfall, but it is that is something that needs to be thought about. But yeah, drink water only. So, okay, so we'll kind of open it up for questions. I know that there's been a lot that have passed me by, but I think teaching people initially and then getting to your questions is something that I feel that is important. So I like to teach a little something when we open up. And today's core teaching was on the benefits of carnivore, and maybe giving you a little bit of an idea of what I think are core dietary principles, what I do for Dr. J. And again, it's not what I expect of everybody to consume, although I think a lot of things would benefit you if you were to even try it for a short period of time, even for the 30 days, is just trying it. Okay? So I'll open it up to questions. If you want your question answered, I'm at the very end. So yes, Babs, January is World Carnivore Month, and that's what we've basically been talking about, just shedding some light. If you are, let's see, I just lost something here. Good morning, Bill. Thank you. Appreciate you. Here's a question from Mr. Smokey. Hey, Doc, I've been struggling with mental health issues. Do you think a certain diet can help improve my depression, etc.? I believe the foods that you choose can affect your mental health. Yes, I truly believe that. If There are two books that I think, Mr. Smokey, if you're a reader, or maybe you can listen on Audible, but there are two books that I would recommend that you look into. One is called Brain Energy by Dr. Chris Palmer. And another one is by Dr. Georgia Ede, Change Your Diet, Change Your Mind. And both of these physicians, both of these health practitioners have experimented for years on ketogenic diet for health-related, mental health-related issues. And so have I seen a change in my own mental health or my own focus, my own clarity by being on a ketogenic diet? Absolutely. Our brains function the best on ketones, whether you know it or not. Eliminating carbohydrates would be in your best interest, Mr. Smokey. And if you haven't already changed or tried this particular elimination diet, I suggest that you do that. Just give it a try and see where it lands you. See if it makes, good morning, Jim, I appreciate you being here. And yes, Happy New Year. But see how it affects you. But Mr. Smokey, it sounds like you might also have been struggling with mental health issues for a very long time. And simply changing a diet, I'm not telling you it is a miracle, but it is significantly more helpful than the diet you likely are consuming right now. With mental health issues, I think it is important to be in tune with a therapist who is very good at whatever your issue is. You know, it's kind of like choosing a family practice doctor when you might need a lung specialist because you have severe asthma. So if you have a certain mental health issue, I would try to focus on a therapist who is very good at your concern. Okay? Likely you have, Mr. Smokey, like we all do, some sort of trauma bond back from when you were a child. That is, as you age, is getting harder and harder for you to conceal. It's leaking. It's harder and harder to hide, okay? And so you're starting to notice it. You don't like the way you feel. You're here, you're asking a question. Could it be my diet? I think that plays a role. You know, eliminating, carbohydrates, increasing essential fatty acids in the form of omega-3s, I believe is beneficial. Increasing protein, animal proteins, getting rid of polyunsaturated fatty acids that are in excess of what we actually need. Seed oils are a big, big problem when it comes to mental health. And so realizing that, but you also have to realize the definition of a polyunsaturated fatty acid also encompasses omega-3s, okay? And I'm here to tell you that we need omega-3 fatty acids. They are essential. We need omega-6 fatty acids. It's just that we are getting way too many. Our ratio of 3 to 6 or 6 to 3 should be 1 to 1. And what we're getting is 20 to 1 in omega-3s, or excuse me, omega-6 to omega-3. That's a lot of omega-6s. They're very inflammatory. They cause a lot of problems in our body. Shelley asks about lupus and what I recommend. Again, you need to one, see your specialist that in regards to lupus, but would you agree that lupus is an inflammatory process, an autoimmune disorder? Most all autoimmune disorders can be triggered right back to your gut and the very irritation and inflammation in your gut that releases, or the things that you're eating could encourage the production of zonulin. Zonulin increases gap junctions, and then we trigger a whole bunch of problems. And autoimmune disorders, I believe, are 80 to 90% of all autoimmune disorders, I believe, trigger from the gut and the gut health. Okay? So, looks like RM is very active right now. Yeah, Mr. Smokey says, OMG, doc is spot on. It is leaking. I've been struggling with mental health issues for 3 years now. ADHD, major depressive disorder, generalized anxiety disorder, and just the last week I've gotten an autism diagnosis. Mr. Smokey, it is easy for a doctor to give a diagnosis and make you struggle with that diagnosis when something, like you said, it is leaking out, but you've been hiding this for years. I know you're looking at it like 3 years. It's been 3 years and it's gotten progressively worse. But you need to, Smokey, go back to the original trigger, the original cause. For instance, let me give you an idea. I've been diagnosed with ADHD, MDD, GAD, blah, 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 autism. Why? Well, they said that I have the symptoms. Why do you have those symptoms? Well, blah, blah, blah. Well, why do you have blah, blah, blah? Smokey, I believe that we do not get back to the original trauma. What is the original trauma that has led you to display symptoms that you go to a doctor who will give you a diagnosis that goes on your insurance for the rest of your life? Okay? I believe that you have these symptoms. I believe that the DSM-5 or wherever we're at now with the psychiatry handbook on changing definitions, I believe you have symptoms. But why do you have these symptoms? We are, as doctors, do we simply just give a medication to cover up or Band-Aid your symptoms when we are not getting to the root cause of why you have it? And mental health goes likely back to between infancy, birth, and 6, 7 years old. All of everything came about with your mental health that is now leaking out at your age because of something that likely occurred between infancy and 6, 7 years old. Until you look into it and process it and admit it, you're going to continue going to doctors. You're going to tell them these symptoms. They're going to give you a diagnosis, and then they're going to treat it with some medicine or some brain shockwave therapy or whatever it is. But finding a therapist who you can trust, who's knowledgeable about all of these things that you're going through right now, because they're leaking out. You're exhausted, likely, Smokey. You're exhausted from hiding the things that are trapped inside of you for so long. And so you got to dig in deeper. And sometimes that takes you digging deeper instead of, I go to this point where we go to the doctor and Smokey, how long did they really spend with you? Was it 10, 15 minutes at the max? And then they said, because you triggered them to say, I think I got ADHD, I can't focus. And they go, oh, you do have ADHD. Here's your medicine. I'll see you in 6 months. Let me know if everything's going okay. What kind of a treatment is that? The medicine of today is no longer looking at what our root causes are. We're just all about making a diagnosis and getting paid for it. We get paid for diagnoses, by the way, okay? We get paid by coding your chart a certain way. So that's the higher the code, the more pay we get. That is how we get paid. Angie, you're 51 years old. You don't have any real major health problems, but you do. You have a real major health problem. It's called a GI issue. And if you have a GI issue, you have an all-over issue. Your immune system, your hormones, everything stems from our GI tract. Thank you, Shelley. I appreciate the gift. It stems from our GI. So do I have any advice? Start with an elimination diet. See what it is that's triggering your gut issues. It hasn't been recently that you're struggling with these. You're just now noticing them, okay? Thank you, Angie. I appreciate that gift. You guys are very generous. This is what helps me. One, it helps me know that it means something to you guys. Thank you, Jade, that you send these things and you value my opinion, whether, hey, you might disagree with my opinion. Okay, this is for information purposes only. I'm not giving you any medical advice. That is not my intention. My intention is to get you guys to start thinking. If Smokey heard something today that gets him to start thinking, or her, gets them to start thinking about, hey, what am I doing going to the doctor, just getting these diagnoses, and they're basically just confirming something that I need them to say, oh yeah, you do got a problem. But why? Did they ever ask you why? Okay. Let's see. Easy do it. I think that you need to consider doing a consultation, seeing a GI specialist in regards to your bowel movements. Alternating bowel movements could be simply from something, thank you, Angie, something that you're consuming. It could be gallbladder issues. It could be bile production. Your liver could be at a disadvantage, and the bile salts that are being made from the liver are not doing a very good job. So there's a lot to look into this. Yeah, it would take more than what I could probably try to read or speculate on what's going on with your symptoms of gut issues. Babs says, what about deuterium? That's an interesting topic that I've just on a surface level have looked into the different isotopes of hydrogen and what they do. So that is an open-ended question, Babs, and I don't know enough that I could even have a conversation with you at this point. Okay. Dirty Muffler says, as a mental health professional, I can tell you Doc is absolutely correct about diagnosis. It sounds like you have been assigned multiple diagnoses, which does not follow the law of parsimony. That's a word I do not know. Can you help me? Shelley says, thank you so much. I do see a specialist, but it doesn't seem to be working out on my health, so I want to do research for myself. Praise the Lord right there. I want to do research for myself. That is my total goal for Shelley and everyone else listening. Take some initiative. Please take some initiative in your health. You take initiative with your car. You take initiative with your house. Do you go and ask the doctor to help you with your house cleaning, or your financial advisor with your house cleaning? No. You take initiative in other things in your life, but yet you rely solely on a person who went to school for many years, mind you, has letters behind their name, yet cannot prove to you that what they're telling you is helping you. In fact, the more and more they talk, the more and more diseases that we're getting. Okay? Think about it. They're doing nothing but diagnosing you, because that is what they do. That's what we've been trained to do. Diagnose you and then treat you. It's not our fault. It's what we were trained to do. You're looking for something totally different. You're looking for somebody who will walk through these things, talk to you, use some logic, use some, pros and cons. You're looking for something more, but you're not going to get it from the typical modern doctor, okay? You're just not, and you're finding that out. So, you say, I want to do research for myself. You're likely going to be smarter and more intelligent than the physician that you went to. All right. Yeah, you're right, RM. Doctors don't want to find out why. Sam says, I think you are amazing. Thank you. Thank you so much for sharing all this truth, valuable information for our health. It means so much to me. You're very welcome. I'm glad you're here. I'm glad you're listening. If you find this, what I'm saying, if you find any part of it helpful, now is your time. Just hit the thumbs up, hit the like, hit the share it with somebody, share it on Instagram, share it to your story, and see if you are able to help somebody who might have the exact same question you have and just is lost. And I'm not telling you that I have all the answers. In fact, I'll tell you I don't have all the answers. But maybe I might spur you to think. And that's my goal. Okay? Bab says psychiatry is a lot of guesswork with drugs. Again, a psychiatrist is a doctor. They went to medical school and they got the same training as a family practice doctor. Make a diagnosis and give a prescription, okay? They are not, repeat, they are not therapists. Adam says, thank you. Let me see. Mr. Smokey, thank you very much for the super chat. I appreciate it. I'm glad I have stumbled upon this Rad Docs live stream. It definitely makes sense to think outside the box when it comes to our health. Yeah, you're welcome, Smokey. I'm glad you're here too, and I hope that you and others. I appreciate it. You and others will find out that you're missing so many things. And again, I'm on a journey too. I'm journeying along with you guys listening. I'm still learning. And that's why every Saturday and Sunday when I do these live streams, I'm basically reviewing things that I am learning over the week. I spend, now that I am not in a physical office seeing patients, I'm at home seeing online consultations. And I prepare for my online consultations way in advance of seeing that person, because that is important to go over. I will send forms and I want to know their past medical history. I want to know their surgical history. I want to know their medications, their diagnoses, their past illnesses. I want to know their family history. I want to know all of those things so I can piece it all together. But a lot of times I get a consultation, and of all of the things that they have going on, it gets back to the Mr. Smokey problem. The Mr. Smokey problem that Mr. Smokey is realizing over the last 3 years, that whatever he or she is trying to hide is now leaking out because Mr. Smokey is so exhausted, okay, of keeping a rap or keeping concealment of the very problem that is now causing all of the symptoms that he's having. Okay? There are studies, and I wrote this actually on my threads today, that research has shown that, and you guys know this, but the more and more problems we have with our mental well-being, it reciprocates on everything that is going on in our life. Every one of our diagnoses goes back to something, I believe, something that occurred between infancy and 7 years old. I truly, truly believe that. And we make all of these diagnoses, and we feel that we doctors pat themselves on the back and say, oh, good, I made that diagnosis, and we gave you the right medication, and we're going to pacify you. And it's really a shame. We pacify every one of your diagnoses, to be perfectly honest. We make a diagnosis, we pat ourselves on the back, we give you the treatment, and we really don't tell you how you obtained all of the things that you got going on, okay? It would, sometimes I start to think to myself that you should probably just avoid going to the doctor, okay? I know that's not reasonable in case you cut your finger off, or need hip surgery, but maybe that's when you reserve the doctor for that. Adam says, talking therapy's fantastic for me after years of medicines not really helping the root cause, as a doctor describes. I agree, Adam, and thank you for sharing your story. It's hard for us to share our stories like that because it makes us vulnerable, but at some point, we're exhausted with the symptoms. You know, I've had a patient, they're not really a patient, but maybe a client, or maybe even somebody in your life that has these chronic you can't really even trace the source of the symptom to anything. And the symptom might be something like numbness and tingling. You got these numbness and tingling symptoms, okay? And you can't trace it back. Everything comes back normal. I believe that that can be triggered or traced back to something that happened in infancy and toddler and up to the age of 7, okay? It's interesting to me when I start diving deep in the root cause of our problems. And, you know, I used to stop at simply, you got diabetes, answer is insulin resistance. Why? We never go any further. It's kind of like at the gym this morning, I was talking to a friend of mine, and they were going through all of their medical history with me. It's one of those things where I haven't seen them for a while, and then they'll go, oh my gosh, I said, how are you? And then all of a sudden I get all this, you know, a recap of everything going on. And I said, has anybody ever asked you why? Has anybody ever asked you why? Let me give you an example. The Titanic. The Titanic, what happened to the Titanic? Oh, well, it crashed. Why did it crash? Well, it hit an iceberg. Why did it hit an iceberg? Well, it couldn't get out of the way of the iceberg. Why couldn't it get out of the way of the iceberg? Well, it was going too fast. Why was it going too fast? Do you see how I asked all the questions of why? So you have diabetes. Why? Well, they told me I had insulin resistance. Why do you have insulin resistance? Well, they told me I eat too many carbs. Why do you eat too many carbs? Well, I like them, and they told me that they were good. Why do you like them, and why do you think they're good? Again, asking the right questions, asking the whys. It's almost like going back to childhood. You know how a kid would say, why do I have to go to school? And the parent will say, because. And then the kid will go, because why? Because you need to grow up and budget your time. Well, why do I need to budget my time? Well, need to go to school so you can have a good job. Well, why do I need a good job? Do you see how kids naturally ask the question why? So are you asking your doctor why? Well, you have ADHD. Why? Well, because you have the symptoms. Well, why do I have the symptoms? Ask why. I know it sounds like a tedious thing, but you need to start asking yourself these questions. And once you get way downstream, you're going to go, oh, now I see. Okay. Lion says, my wife was prescribed a statin by a new doctor solely based on family history. The doctor had not even seen the blood work. That is the last time she will see this doctor. Lion says she ignored the advice. And again, Lion, did your wife ask why? And they'll say, family history. Why? Why? Ask why. Get to the root. Find out what the doctor knows or doesn't know. Okay? That's comical, Lion, but thank you for sharing. RM says, how do we figure out why? RM, I guarantee you, if you ask enough whys, you will get to a root cause. You haven't gone farther downstream enough to know your why. Just trust me on that. You need to ask more questions. Ask more questions, get deeper. And when you can't think any more whys, ask somebody else why. They will come up with another why. It's very important that you get to the root cause. And even when you think you got to the root cause, there's even deeper whys, okay? More WHY, question mark, okay? Shelley says, yes, I understand. Thank you so much. We do need more doctors like you. Amen. Or just maybe more, well, yeah. Lion says she even had a 0 calcium score. So her chances, Lion, of having a problem, with heart disease is pretty small. She's probably following a different lifestyle than her parents did. And having a low calcium score or 0 calcium score, along with a triglyceride to HDL ratio of less than 1, having an insulin level between 3 and 5. Thank you, Shelley. I appreciate your gift. I do appreciate you guys sending me the gifts, sending me the stickers, sending me the chat, super chats. That all means a lot to me, okay? And it means a lot to this channel. It's how we keep it going. Babs says, so my point about deuterium, which is a hydrogen isotope, interfere with ATP production. Again, I would probably need to look into it, okay? Babs, I do appreciate you trying to educate me, and I will look into it. Maybe it's something that we can talk about in the future. That's true, Light Star. If we don't go to the doctor, we never have a diagnosis. However, if you ask enough whys, you will have your own diagnosis, okay? Babs says, oh, you're a DO. Yes, I did go to osteopathic medical school. That explains a lot on why you are way better than most MDs. Well, I would like to take credit for that, but I'm going to tell you that DOs and MDs got the exact same education, okay? The curriculum was written by the exact same people. The curriculum that an MD and a DO takes is exactly the same. The difference might be the size of the school and the teaching of osteopathic manipulative medicine. So OMM or OMT, osteopathic manipulative therapy. We did get trained in manipulation and the origins of maybe what our body is sensing and trying to fix those things. But you know what? Now that I think back, I didn't ask why. Why would I have a trigger point right here that I can fix by manipulating this particular area with either muscle energy or high velocity, low amplitude? I never asked why. I'm not asking why until 27 years later or 25 years later. It's not that I know anything any different than an MD. I'm just applying myself. I'm applying the fact that I have a brain that I can look things up on my own and not rely on somebody's letters behind their name. I don't go to the doctor unless I need to have my fingers stitched back on or something sewn up that I can't do myself. I'm going to go to the doctor. But if I want to rely on a doctor to try to heal my chronic diseases, wow, I might get a little bit of information from them, like do my labs for me so I can look at them myself, but I got to train myself to read my labs. They are not doing it. They're looking at the reference range and they're saying, you look good, Dr. J. Keep going, keep doing what you're doing. Sounds like you got it all worked out. Serb says, my father struggles with Helicobacter pylori for 15 plus years. It'll always be positive. Once it's positive, it'll always be positive. So treating it over and over and over again is not in your father's best interest. If it was treated once, then the likely the treatment works. But the fact that he's an alcoholic and the fact that the diet that he consumes is feeding bacteria in general that are causing problems. So you're feeding bacteria that are causing more and more problems. You're using Manuka honey, which increases the immune system ability of our gut to work, but why not just take away, Serb, the things that are causing the problem? And again, ask, why is your dad an alcoholic? Well, because blah, blah, blah. I don't know your situation, but, ask the whys. And it'll probably trigger why he is relying on alcohol to soothe his inner infant to 6-year-old self, okay? Somewhere along the way that he was brought up is causing him to be the alcoholic of his adult life. Nobody's been asking why. In fact, your dad hasn't asked why. Maybe you, Serb, can help your dad. Ask the why. Ask about his being brought up, and start looking into it. Right, RM, thank you for clarifying. I am not saying don't go to the doctor and don't get a diagnosis. I am saying figure out the whys of the diagnosis. So if you go to your doctor and you get the diagnosis, are you going to do anything about it? You can't do anything about it until you know why. Their idea, the doctor's idea, is not to figure out the why. It's to treat you. That is their job, okay? If you go to a mechanic and the oil needs to be changed, they're going to change the oil. Did you ask, why does the oil need to be changed? Well, it needs to be changed because it makes the engine lubricated and run better. Well, why do I need it now and not in 1,000 more miles? Because the oil doesn't work as well in the future. More and more use, it doesn't work as well. More debris gets caught up. Ask why. Start learning something. Goal, do I know anything about veganism? I do. But if you have a specific question, ask away. Slab, it sounds like what you're stating about, the people in your life, and it looks like that boiling frog is agreeing with you. These are reasons that particular person didn't end you, and please hear me out. I'm not putting the blame on you. In fact, I'm telling you it's not your fault. Boiling frog, it's not your fault. But something in you, slab and boiling frog, is something, a defense mechanism that you acquired when you were at a certain informative year in your life. And due to neglect, abuse, whether it's physical or emotional abuse, whether it was the neglect was, and I'm telling you, neglect can be engulfing and neglect can be ignoring, but something in your childhood during your time when you should have been developing independence, becoming a you, slab, becoming a you, boiling frog, you were held back. You were not nurtured in such a way that allowed you to become the adult that you needed to be. And so you have somehow attracted that type of person who almost ended you, okay? But instead of putting the blame on that person, ask the whys of why that person was in your life. And you got to go back. I mean, go back. And some of the tiniest little details will start to come out because likely, you have either suppressed or repressed something from that childhood. Now, if you've repressed something, to allow that to be brought back into the here and now is very difficult. But if you suppress something, it is much easier to bring that out into the open and work on that. But a lot of times it takes going to a therapist who is very good at talking about your particular type of person that came into your life, slab and boiling frog. That person sniffed you out from across the room, sniffed you out because you were the exact person they needed that they weren't. So not only do you have some trauma bond, but that person has a trauma bond. And they sniffed you out because you, being the good person that you are loyal and giving and empathetic and all of the things. You're probably very highly functioning as well. But they sniffed you out. And they said, that person is the exact person that could feed me for the rest of my life until I, get old with them. They idolize you or idealize you, and then they start to devalue you. And that's the part where you feel like you're ending, right? The devaluation. And it's so subtle, depending on what type of person that you attracted. It could be very subtle or it could be way obvious, okay? Very obvious. But the devaluing is intermittent because it's intermittent not only with devaluing you, but also giving you a little bit of a hit. I love you. You're the greatest thing that's ever come into my life. Or you're so good at that. That little bit of hit triggered you. Just that little bit of crumb kept you going, kept you in their orbit until you say, wait a second, and you woke up slab and you woke up boiling frog because now you know how to actually identify what that person in your life is. Before, you didn't know. You didn't know what was going on, but you go, that's cognitive dissonance. A part of it says, oh my gosh, this feels feel good. And then over here, it feels horrible. If you have a friend or somebody in your life that's really, really important, and when you get done with something, being with them, and they make you feel like, what just happened here? That is not a very good relationship, okay? So the devaluing is what likely puts people over the edge, and they feel like I could commit suicide here. It's because of the intermittent reinforcement that kept you going, because somewhere slab and somewhere boiling frog, you felt that if I could just do something more for that person, I could try harder, I could love harder, I could, help fix their problems, do the thing, whatever it is. Somewhere in your history, you were set up to do that, okay? And you found the perfect character in the story to help, but they sniffed you out. And what you describe as, they almost ended me. They destroyed you. They devalued you. And then eventually, they'll discard you. That is the way of that type of person, okay? But you have to find out why you, not them. You can know them. They sniffed you out because they're this and that, and you labeled them. But what about you? Now you need to go back and label you slab and you boiling frog. You need to know what is in you that actually attracted that person and work on that. The fact that you're here and you survived, there's not very many people who do that. Okay, there's not very many people who have survived that. Survived it and are now can talk about it. Okay. So it's very important that you share your stories. I'm glad I found you too, Slab. I feel like I have maybe opened your eyes to a few more things, I hope. Boiling Frog lived with this type of person for a long, long time, constantly wanting to argue. Then when I'd kick off, she'd play the victim to all and everyone. That's a smear type of campaign that they do after the fact, okay? There's different types of spectrum of that type of person, Boiling Frog, and not everyone that you're discussing about this particular personality, cluster B personality disorder, follows the same things. So what your experience is that, they would play the victim. Not all of them play the victim. They do have some vulnerability to them, but not always showing it, okay? But they can manipulate all of their other sources, all of their other harem. She likely had a harem of people who could defend her and go against you because she already had them in her orbit, okay? They worked for her, Boiling Frog. The fact that you even reacted gives her, it could be a negative reaction, it'll feed her. You give a positive reaction, it'll feed her. You give her no reaction, it'll feed her, as long as she knows you're still in her orbit. As long as you're still on the shelf, okay? You can be used later. And that's just the way it goes with these type of people. But you need to look into, her family history, her childhood, and then you can start connecting dots. And now you can start naming it. But it goes further. You have to heal, or else you're going to continue, Slab and Boiling Frog are going to continue to attract these type of people in their life. Okay? Okay. Food and Home Prep said, I do avoid doctors unless I'm sick, which is rare. During COVID, I woke up to the brainwashing. I just take care of myself, and when I slip up, my body tells me. Right on. That's all you can ask for, right? Boiling Frog says, funny that when you're genuinely ill, it's real hard to see the doctor, yet they're hell-bent on you popping in for the flu shot. Yes, whether you're sick or not, right? Let's see. Sam says, I really feel tired immediately after eating. Could I possibly have symptoms of insulin sensitivity? Well, Sam, what is probably happening is you have such high levels of insulin, it's dropping your blood sugar down very low. And so, it's kind of like eating Thanksgiving dinner. That's why we go to sleep. So insulin is very high, drops blood sugars down. Your tendency is to eat again. Miriam, thank you for joining. Please hit that thumbs up, hit the subscribe. I really appreciate it. Share this video with people. Instagrammers, I don't see that you have any questions over there. You're kind of just listening in, and I appreciate that as well. Josh asked, do you eat eggs? I do eat eggs. I love eggs. I eat them every day. I used to eat 10 a day. I'm eating more meat, and I'm probably eating about 6 eggs a day. Bab says, I heard that DOs try to get to the root cause. Again, I think it all depends on the doctor. I mean, whether they got a DO or an MD behind their name, I'm not sure that it matters. Two-party, I'm glad that you find the advice excellent. I appreciate your comment. There was a question earlier about raw milk and what I feel about that. I think if you're going to drink milk, I would drink A2 milk. If raw A2 milk is what you desire, go for it. I don't know the problem with your sweating on one side of your nose. I'm sorry, I can't answer that. Same with speaking to non-epileptic seizures. You know, I believe with anything, again, I'm not a neurologist and I don't know, I can't speak to your seizures, but what I can speak to is brain health. And the more that ketones are on board, the less neurodegeneration that is occurring. So increasing ketones would be in your best interest. I'm trying to scan for questions. If you have a question, please put a question mark before it or do a super chat and I'll answer it right away. Two-Party Illusion says, I survived and thrived. It took self-help books. I went to school for social work. Abuse is dangerous. It is. Abuse comes in many different forms. And I'm glad that you're here to speak to it, Two-Party. Food and Home says, when I ended the bad relationship, I felt so free. I realized I'm good enough all by myself. You are good enough, but something from your past told you you weren't good enough. And so you had to validate yourself externally from another person or a thing like alcohol. The external validation is what's getting us in trouble because we have no internal validation. People like food and home prep have found where their internal boundaries are non-existent. And a lot of times that happens from a childhood trauma. Again, looking into that and then working on knowing that the little person in you is valued and is good enough. And there's a lot of good books that I'm just trying to think. I actually believe Food and Home that one of the books that you might have already read it is Why Am I Not Good Enough? I can't remember the author, but I believe it's a therapist that's written a few books, but why am I not good enough? So it kind of goes to answer, you're realizing that you are good enough and you don't need that external validation of what's going on, to make you feel whole. And that is what I'm talking about, is you need to work on yourself and ask the whys. Why am I like that? Why did I, get to the point where I'm, as an adult, attracting all of these people who are sniffing me out? And why? Okay. Angie says, I feel that emotional pain is worse than physical pain. At times, I think that could be true. Everybody has, experiences trauma in different ways. Okay. RM says, I've been through all forms of abuse, including narcissism. Yesterday, I was able to call out an abuser in public. He wanted my chair and seat, even though he came after me. And so RM would not have been able to recognize that had they not gone through in an experience. And then taken it further is to know, how do I need to name it. What is that called? What is that technique? What is that, what is that diagnosis? I hate to use that word, but sometimes it helps us connect dots when we can actually put a diagnosis to what they got and what we got, okay? What do I have, RM? What would make that person sniff you out of a room and ask you for your chair and seat, okay? Why? Anne, that's a good question about cold weather and exerting yourself. One, I really think that you need to be in shape when you're out in, freezing wind chills, is to know you have limitations, okay? Maybe it's time or a time that you can put the shoveling of the snow on the back burner if in the next 24 to 48 hours without getting fined, for snow removal. But maybe you can hold off on, just temporarily holding off on going out and doing any type of exertion in that weather. Be safe. Always err on the side of safety and hypervigilant versus, you know what, I'll just go try it. Should you mask up? I think it's very important to cover your skin when they're below freezing temperatures and wind chills. It's just only ruining your skin. And moisturized air coming in is better than the dry air coming in. So yes, breathing through your nose and breathing in through your nose and out through your mouth, that helps. So yeah, I would put a covering on it. I do. I cover everything. I don't want my skin to be exposed to the elements of that type of cold. Angie says, addictions run in my family. How can I educate my teens about this touchy subject? One, Angie, I think don't necessarily bring it up to them about them. If you, this is one time where I like beating around the bush. If addictions do run in your family, you now know, Angie, that you have a multi-generational problem stemming back not to addiction as the diagnosis, but you need to find out why. The whys. That is what you need to teach your teens about, is the why. Okay? The addiction is the survival mechanism that is running in your family. Okay? But the multi-generational problem stems from a different diagnosis. Okay? Because you don't just get born with addictions. Multi-generational, like what Boiling Frog and what Slabs was talking about, and or the other person that has experienced these types of people in their life, that is multi-generational. Look back at your history. Look at your mother. Look at your mother's parents. Look at your mother's parents' parents. And it will teach you. So instead of saying, kids, I'm really worried that you're going to get these addictions, as if you poofed and you could breathe the air and you're going to get an addiction. But likely, Angie, you have a multi-generational diagnosis, okay, that you've likely taught your teens. And they're already teens, so they've already been affected at the most opportune time in their life, in their informative years between infancy and how they were treated during infancy, upwards to 6 to 7 years old. And so I don't want to tell you that it's all too late. But what they've already developed, their coping mechanisms, their survival techniques are already in place. And you have to start recognizing them. And even if you recognize them and you say, oh my gosh, I remember my parents have this and this and this, and I tried not to do it. So you actually did the opposite. So say your parents neglected you, okay? They neglected you. They left you at home alone. They did whatever it was, that they didn't develop a bond with you. The bond wasn't there, and then they didn't allow you to do any developing independence at the age of 2, and on and on and on. And you say, I'm never going to let my people do, thank you for that. I'm never going to let my kids be that way. So you do the exact opposite. You engulf them, you love them. And now what you've done is you actually never allowed them to get independent. You were the helicopter. You smothered them because you didn't want them to develop what you got, but you actually caused it. I know it sounds crazy, but until you work through your whys and keep going back, you're never going to connect the dots. And so just simply speaking to your teens about not drinking alcohol, they're going to say, why? Everybody's doing it. Well, because it's poison. Why is it poison? And again, it's going to get back to a point that you would never put cyanide in your mouth because you know it's a poison. But alcohol is a poison, and you would put it in your mouth. There's something messed up with that logic, okay? There's something messed up. There's something messed up that we would, there's a lot of stuff messed up about a lot of stuff. But you're asking me, how do I, how would you talk to your kids? I would not make it about them. I would make it about what is it about your family, but you have to trace it back and you have to be really, really, really good at telling the multi-generational story, okay? Dane, I do not know the answer to your question. I apologize. Vabe says, how do I deal with loneliness? Distracting myself with self-improvement works. What do you mean self-improvement? But there are periods when the void hits. Okay. Did Vabe, did you ask why? Why are you lonely? Okay. You don't know the diagnosis yet. So for you telling me why, how do you deal with loneliness? I'll say, well, go be around people. And then you say, but that doesn't help. Well, why doesn't it help? Well, then you'll say, because I could be around these people, but they do nothing for me. Why? Well, they don't love me the way I want to be loved. Oh, why? Well, it just reminds me of something why? Vabe, you've got a diagnosis, you're lonely, but you don't know why. So you cannot deal with it until you know why. Okay? It's kind of like the person, like Boiling Frog and Slabs, who allowed a not so good person to come into their life. Okay? Why? And why would you allow it to go on for lengthy periods of time, even though you feel horrible once the interaction is done? You go, what just happened here? Yet the dopamine hits that they give is what kept you hanging on. The intermittent love bombs and attention they gave you is what kept you going. Okay? So ask yourself why. Okay, Vab, probably because I've been betrayed by people I once put my trust in. Why were you betrayed? What was the betrayal? And why were you betrayed? I would need to know deeper, okay, what about what is going on. Let's see. Did I miss, RM, did I miss any questions along the way here? Chuck Holsters, the holster guy, thank you for joining and thank you for following. And now hit the thumbs up and hit the share button and yeah, do all those good things. Okay. Good, Angie. I'm glad that it's hitting home here. Okay. A little, this is amazing. You guys are starting to ask these questions, and I'm starting to trigger things in you. And now Little is saying, when I got my autism assessment, the results came back saying that I also have unspecified. That means unspecified depression. Yeah, we don't know what you got, but we're going to call it depression. You just seem sad to us. You answered all the sad questions right, and we don't know why it's unspecified. That means we really don't know the answer. What a dumb diagnosis, Little. That is such a dumb diagnosis. It reminds me of the word iatrogenic. You got iatrogenic depression. Iatrogenic means, we don't really know why, but you are. They didn't even ask why. So they just give you unspecified. It's a diagnosis of exclusion. We can't figure you out there, little, so here's your diagnosis. Here's your medicine. I'll see you in 6 months. Call us if you need anything. How do you find out why? Ask the questions. You need to start asking the questions. Nobody else is going to. What does unspecified white matter mean? I'm guessing you're talking about in the brain. They found something on the MRI and they didn't know why it was white, why that area right there is white. And so we couldn't find the diagnosis. So it's called unspecified. It is a dumb diagnosis, 19 time. You're right. I mean, now that your guys are starting to see and start to use your brain and think logically, you're thinking of a lot of stuff that seemed like a really dumb thing. Like this one goes back to something that really triggers me. If you eat meat and only eat meat, you're going to get diabetes. Meat causes diabetes. When I ask why. Yes, it's another way of saying I don't know. You're exactly right, Vic. Thank you for being right on. I want to know why. Tell me why you think meat causes diabetes. Well, because everybody we ask, because that's how you do nutrition questionnaires, is you ask them, do you eat meat? Yes, I eat meat. Do you have diabetes? Yes, I have diabetes. Is that how we diagnose that you have diabetes and you eat meat? Or do you eat meat on a bun with ketchup alongside French fries and more ketchup and a sugar soda, and then I had a dessert of an apple pie? Is that why meat causes diabetes? Did we not think to ask why? Um, 1910, I agree. Little may not be depressed. Little might be just now acting the role. The doctors want me to display the diagnosis of depression, so I'm going to display it. Wow, it explains everything. Why I don't want to get up in the morning, why I don't go work out. You guys have to remember something. The human naturally wants to avoid anything hard and painful. They see the negative before they will see the positive. If I move away from hard and away from painful, naturally, I'm going to move toward joy and easy. But the first thing our brain tells us to do is to move away from pain and hard, something that is hard and painful. So if you're talking about your doctor diagnosing you with depression, if hard and painful would be me trying to describe to you why you were diagnosed this way, I'm going to move away from that. I don't want to talk to you about that. So I'm going to move toward joy and easy. If I give them the diagnosis, then I can give them a medicine, and then they'll find joy and easiness instead of doing the hard, painful thing. Okay? You know, there's something that most people will never mistake a snake for a stick, but they will almost always mistake a stick for a snake. We have a tendency to move away from pain. So if we see a stick on the ground, our first inclination, that might be a snake. Okay? It's dark, you can't really see, that must be a snake. Okay? That is moving away from hurt, pain, hard. You're never going to see a person that says, oh, that snake, which it really is a snake, is really just a stick. Not going to happen. Okay? For instance, I'm going to give you a scenario that happened this morning, and this is where I use this. I knew about the snake and the stick. Okay? I'm walking in a park, and it's dark, very, very dark. There's just moonlight. And my dogs are running and they're enjoying, and all of a sudden, they stop dead in their tracks. And my one dog is a barkless dog. I found out by asking the whys, I used AI to figure out what my tallow might be, breed-wise. And I found out, and after asking all the whys and telling all the symptoms to AI, we narrowed it down that my tallow is a Basenji mix with a dachshund. And so that explains this weird, I thought that whoever dumped him in Oklahoma, in Norman, Oklahoma, thus his name is Norman Tallow, I thought they probably tore his vocal cords out because he was barking as a puppy. Nuh-uh. He is somewhat of a barkless dog, a Basenji. They sing, they howl, but they don't bark. But because he's got dachshund in him, he's got a little bit of a sound that comes out. He made a sound this morning. I used my x-ray vision this morning, and I saw something off into the distance on 4 legs. Okay? My first inclination wasn't, oh, I think it's a cute little dog that needs to be rescued. No. My inclination was, that is a coyote, and we need to start walking the other way. I did not mistake the snake for a stick. That wasn't my inclination. My inclination was hypervigilance and to walk away from pain and hard and get out of there. Is that making sense to everybody? The way you change, to make a change and to change your habits, is actually learning about hard and easy, pain and joy. Little, you might be depressed. I get it, but why? Why? Why do you have a diagnosis of depression? Keep asking why. Could be bipolar. Again, why? You don't just have diagnoses, okay? That's the easy way out. Dig deeper. Get hard. Get painful. There's something else little deeper. It's making you vulnerable, but you need to ask the questions. Once you know the answers, you're going to go, wow, now I know why I was sad and down and blue. Okay? You don't just take a medicine. Jackson, I'm sorry, but I didn't see a European 101 through Super Chat. It's not registering up there. So maybe you either didn't fulfill that Super Chat, but I don't see it. And Mr. says you didn't. So, okay, we both agree. Jackson really didn't give European 101 Super Chat. But if you do, I will thank you for it because I appreciate all my Super Chats. VA or VAB says, whatever relationships I have invested in weren't fruitful. What is fruitful? I always tend to lose a part of me. You did not lose a part of me. You gave a part of you away because you don't know why. You gave it away. They didn't take it from you. Nobody can steal a part of you. You gave them a part of you. I hate to put you to blame, but you gave the part away and you lost it, but you didn't lose it because they took it from you, okay? You don't know why yet because you haven't asked the right questions, okay? You don't fall for the wrong ones. You attracted the wrong ones, into your life because of your why. And it's very, very deep. Deep therapy. Intense therapy helps. Vic, they would rather go to the hot spa. Yeah, I agree. But there's probably some benefit to going to the hot spa, right? Yeah, 1910, I would agree. Those are great survival techniques to do, is getting out in nature. Let's see. I'm trying to read through the questions. I'm reading comments as well because I can't see any questions because there's one, no question marks in front of them, and two, there's no super chats. Little says, girl, that's why I'm trying to figure out. I'm 13. Oh my gosh, you have the rest of your life. If half the people like frogs, boiling frogs, would have been found out what was their trauma bond when they were 13, they probably wouldn't have spent the last 40 years trying to figure it out. So you are way ahead of the game. When these people were 13, they didn't likely know there was a problem. The fact that you know there's a problem has kudos to you, little, that you actually have thought about that there's a problem going on. Okay? Awesome. Awesome. Keep going. There's questions here, but many of them are questions that I don't think are relevant to be answering on here. Okay. Yeah, I understand, little. There's a lot of people that don't want to grow up, and it's a scary thing. You want to grow up and you don't want to grow up at the same time, but there's a reason why you feel like you don't want to grow up. Okay. Mr. Mister says, I think all of us have a child in us. I would agree. And it doesn't matter what age we are, but usually that child in you is stuck at the age where they had the trauma bond. Believe it or not, Mr. Mister, your child, wherever you were traumatized, like little could be traumatized at age 12 and now starting to open up at 13. The trauma bond is wherever it occurred, and now that child is the one stuck in you, and they have trauma. They have a trauma bond, and you need to figure out what that is. Okay, you guys are not sure. RM is still working. RM is my blue wrench today. One of my moderators. So we're scanning for questions. RM, did Little ask a question that was not appropriate? You timed him out. The Look Lab, are you a vegan teacher? No, I'm not a vegan teacher. I'm not a carnivore teacher. I'm a health teacher. Do I teach about vegan? Absolutely. Do I teach about carnivore and ketovore and keto and standard American diet and everything else? Absolutely. Okay. Any other questions, you guys? Oh, here's one. The best way to quit, is that smoking? Is that what you're asking? Lisa, let me know. If you guys want to sign up for a consultation, go over your labs, go over your medicines, go over your medical diagnoses. My consultations are for information purposes only. It's to help for you to gather information to take back to your doctor and to have a good relationship with your doctor. I do not replace your doctor. I am not your doctor and you're not my patient. Doc, you use collagen protein powders. I do not. I eat meat, and meat is full of collagen and protein. So if you would like to sign up for a consultation, email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Oh, okay. Thank you, RM. I appreciate that. I didn't see it. You know, it's unfortunate that we are trying to help people and then they use some sort of derogatory comment to put themselves in a timeout. It really is unfortunate. Any tips for PCOS and weight loss for someone who is in a wheelchair? So what you're telling me is that you can't be as active as, or what I'm hearing is the fact that you're in a wheelchair, you can't be as active as somebody who's not in a wheelchair. Well, I guess it depends on what your definition is, a definition of, being handicapped. But I have people in my life who are in wheelchairs who do exercise. Not that exercise is going to help with your PCOS. I mean, maybe 10, 15, 20% of fixing or helping or treating you for your PCOS is exercise, okay? I'm going to leave it at there. But the 80% is your diet. 80% of people with PCOS can be fixed with diet. The reason you have PCOS is that you have high insulin. So I would ask, SAD, what is your insulin level? If it's above anywhere from 3 to 5, then you have hyperinsulinemia. When you have high insulin, you and your ovaries are not working very well, okay? Let me just tell you this. All estrogens, which you lack, start from androgens. So all of your estrogens started out as testosterone, okay? And testosterone is supposed to convert to estrogens via aromatase enzyme. And yours are not. So you have low estrogens and high androgens, testosterone. And so you're getting all of your effects of testosterone, whether it be hirsutism, hair growth, infertility, weight gain, especially of your abdominal area. You'll have these somewhat thin muscular legs and a very huge or very wide abdominal girth. That is PCOS. A lot of hair growth on the neck and chin. Even breast development will be down. You'll be more flat chested, but you have a giant abdomen. That is PCOS. That is an inability to convert androgens to estrogens. And that is caused by hyperinsulinemia. So basically you have diabetes. So the treatment of choice by modern doctors is to put you on metformin to drive the sugar that you're consuming into the cells. When the absolute reason that you have insulin resistance or hyperinsulinemia is the fact that your body, your cells, they become insulin resistant because they don't want any more energy coming in. Yet you'll take the metformin from the doctor to drive in more energy into a cell that does not want it. It's a protective mechanism that you're now forcing it to take more and more in. So yeah, you don't have blood sugar in the bloodstream, but now you're trying to force it into the cells to make them more and more inflamed and insulin resistant. So they start leaking out their fats and their cytokines. You get more and more inflamed when all you had to do is remove the carbohydrates and your PCOS will reverse. You don't treat PCOS with more estrogen like birth control pills. You treat it by allowing your body to make your own estrogens. Right now, you have a buildup of androgens that can't aromatize to estrogens. Okay? So SAD, instead of taking a whole bunch of medicines, get rid of the thing that is causing your problem. Insulin. Insulin goes up with carbohydrates, alcohol, high cortisol, no sleep, no activity, stress, all of those things. Okay? Please repeat slowly your website. My email address is ironladydoc@aol.com. IRON, Lady, LADY, doc, DOC, @aol.com if you want to sign up for a consultation. I am on almost all of the social medias at IronLadyDoc, IronLadyDoc. Rumble, Twitter, YouTube, Instagram at IronLadyDoc. Facebook is the only one that's different. It's Center Stage Primary Care. Center Stage Primary Care. That is the name of my family practice business. Do I stream at regular intervals? Yes. Every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. I am thinking about adding in another day. But we will, yeah, I'll consider it. I'm thinking about adding in another day. Okay. RM says, I bought 3 books on PCOS. I will let you know what I think about them over the next few weeks. Good. SAD doesn't know been told that they have high insulin, but don't know the numbers. Find it out. But yeah, if it's over 5, the ability to lose weight is going to be harder and harder. When insulin is higher, when insulin is over 5, 6, 7, 13, 14, it becomes really, really hard to lose fat. And so when insulin is high, you tend to lay down fat, not burn fat. You cannot burn fat, your fat, when insulin is high. All right. I helped you out, RM. I helped you out. Is insulin and glucose the same? It is not. Glucose is blood sugar. Insulin is a hormone that is released from your pancreas beta cells that is released in the presence of glucose in the bloodstream when it reaches over a certain level. But insulin is always on board in the value of around 3 to 5. When we consume something, it will spike glucose, and glucose will spike insulin. And then insulin helps to drive that energy into cells where it can be used. Okay? Two Party says, I have postprandial hypoglycemia, low blood sugar. Emia means blood, and glyce is glucose, and hypo, low. So low blood sugar after eating high sugar meals. So your high sugar meal spiked your insulin likely higher than what it needs to be, and then that lowered your blood sugar really, really fast. So you're on a roller coaster. So my suggestion to you is don't eat the high sugar meals. Don't eat high carbs. Lower your carbs or no carbs, and your hypoglycemia after meals will go away. You've had it for more than 25 years. You've likely been diabetic for 25 years. No, your pancreas does not have a limited amount of insulin. However, you can get beta cell burnout, and then your beta cells will be working very, very hard to produce insulin, and that's why people, type 2 diabetics, will become a type 1 diabetic. Okay? Sad says, yes, I was on birth control for years for the PCOS, I'm assuming, and I feel like it only made it worse. It did, but you also made it worse, okay? By what you were consuming, the high insulin prevented your ovaries from aromatizing the androgens into estrogens. The answer is not to give more estrogen. the answer is to help your body convert the androgens into estrogens. You're very welcome, Sad. I appreciate you being here. Oh, okay. Let me see if I know how to pin. There we go. Okay, RM, thank you for that. I just pinned it. Okay. Dane says, my doc told me that I was allergic to sugars. Allergic. Did you ask them to define your allergy to sugars? Chemical worse than natural. Okay. So define chemical sugar, define natural sugar. And I want to know the definition as far as the chemical formula of a natural sugar as compared to a chemical sugar. Can you explain what diet I should follow? No, but if you truly are allergic to sugars, which you are not, your body makes it. Your body makes between, I'd say 6 and 7 grams just from gluconeogenesis from the liver. So yeah, I find if you are actually allergic to your sugars in your body, you'd be a goner. Yeah, you're welcome, RM. Thank you for being here. Thank you for being my blue wrench. I appreciate it. Antoinette, type 2 diabetes, very stressed, taking sleep tablets, calming tablets. It is good idea to go to rehab to detox, stay off, not very hungry. Antoinette, sounds like you need to get, see your doctor, okay? Lisa asks, why do I get keratosis on my legs? What are keratosis? I mean, I think I know what your keratosis is. Osis means a condition of keratin is skin. So what condition of your skin do you have, Lisa, that you have on your legs? I need you to tell me what your actual diagnosis is. Mr. S, do you eat a lot of salt or sugar? I do not eat sugar. Do I eat salt? I do like to salt my meat and eggs. I use Jacobson's kosher salt at the moment. I like it the best. Lisa says blotch sores. I still do not know. Lisa, I would recommend that you go to your doctor. Gosh. Raja, I don't know exactly the genetics behind your hair falling out, being on the mother's or father's side, but I think a lot of what we do is we feed it. And I'm guessing you're male, Raj, and I would think about why you might have higher DHT. You need to have labs done. Get some labs done. Oh, sad. I'm sorry to hear of your, your misfortune at the age of 13, but you have to ask yourself, why were you having a condition of PCOS at age 13? What in your previous 12 years, 13 years, caused you to have PCOS as a diagnosis? Being placed on birth control pills for 5 years worsened probably, worsened your situation with your hypothalamic, pituitary, adrenal axis. And there's a lot going on here. Sad, but changing things, it can be reversed. How about that? You can fix this. Some of the questions that are being asked are very open-ended. And so unless there's a specific question, it's hard to answer. Chris has triglycerides of 1,300. What do you do? I would see your doctor, and I would consider a consultation. We can go over it and go over the remainder of your labs. If you want a consultation, just email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Mr. asks, is it okay to take ashwagandha in type 2 diabetes? Why would you take ashwagandha in type 2 diabetes? Also, it's hard for me to follow along with your messages or your questions unless you restate the first question, because Dane, I can't remember what your initial question was, to be able to comment. Jackson asks, what's your opinion on eating dark chocolate bar every day? It doesn't matter what my opinion of you eating a dark chocolate bar every day. Would Dr. J eat a dark chocolate bar every day? No. So my opinion really doesn't matter for you. Jack, you need to ask yourself, is eating a dark chocolate bar every day good or bad for me? Okay. Do I eat seaweed? No. Sad, in your case, it's likely a no-carb diet, okay? You have underlying diabetes. Maria asks, Doctor, do you think a carnivore diet is the best diet for a type 2 diabetic? I don't think it matters what chronic disease you have. I believe eating an animal-based diet is in everybody's best interest. Okay. Looks like RM is being very active here in, I do respect a lot of your questions. However, some of them I have no respect for, and I don't think they're appropriate. So, those require us, because they're taking up so much space, to put people in timeout. And I believe that other live streams do that as well. So if you're asking why people are being put in timeout or being eliminated from the chat, it's because they're taking up space with derogatory comments or derogatory questions, okay? I have female 46. I have HS. I'm in perimenopause, and it's become very calm. Will it come back aggressively in the future? I can't answer that, Pam. I don't know the answer. Everybody's body is different. Yes, dark chocolate can have heavy metals because it's a plant. It grows in the ground, and the ground is saturated. Our soil is saturated with heavy metals. So not just dark chocolate plants, but all plants. Alexandria, what are the side effects of eating too much natural peanut butter? Number one, gaining weight. Peanuts are very, very high in molds. And even though it doesn't have any salt and sugar, no palm oil, no additives. I get it. You put honey in it. That's a sugar, right? So it does have sugar in it, right? Honey's a sugar. It doesn't matter if it's natural or not. What is the difference? Give me the formula of natural sugar versus table sugar. Give me the formula and tell me. Well, table sugar is sucrose, but give me the glucose and fructose formulas that are in this sugar and the formula that's in your local honey, okay? Yeah, Obviously, it's been addicting to you, Alexandria. Okay, Jackson, awesome. If you and Willy Wonka have think that dark chocolate is in your best interest, then continue doing it. Oh, awesome. Fabian asks, what do you think of TRT over age 50? Why are you needing TRT? What are your labs? Why isn't your testosterone at the level it should be? Ask questions first before going on TRT. Ask the whys. You haven't given me any whys on what to answer what my thoughts of TRT over 50 is an open-ended question that I'm not going to get into. Why do you think you need TRT over age 50? Okay. Let's see. Let Raw Foods ask, what is your opinion of an ideal diet? If you want to watch this live stream at the very beginning, I discussed the core dietary principles of Dr. J. That's me, Dr. Jensen, Dr. Malea Jensen. I went over Dr. J's core dietary principles, so you might want to rewatch the very first maybe 25 minutes of this live stream, and it'll give you the answer. Thank you, RM. That is glucose, that is sugar, the chemical formula. Now give me the glucose chemical formula that is in honey. Remember, honey is glucose and fructose. So I guess, RM, if you want, you can give me the chemical formula of the glucose that's in the honey as well, which you can just copy and paste if you'd like. Chris, what is more effective for insomnia, melatonin or magnesium? Or is it different for everyone? Chris, why do you have insomnia? Why are you having an inability to sleep? And what is your insomnia? Is it early insomnia, you can't get to sleep? Is it middle insomnia, or you're waking up frequently? Or is it late insomnia, you're waking up in the early morning hours, unable to get back to sleep? So by definition, I don't know what your insomnia is to be able to treat it. But again, I would ask you, why do you have insomnia? TRT because I'm very tired, no drive, no sleep, no muscle gain, and belly fat. What is your testosterone level? And why is your testosterone level low? If you have belly fat as a male, what is the most common cause of belly fat in a male? It's called aromatization. Your testosterone is aromatizing. You have like a little ovary. You have an ovary in your belly fat. Your belly fat is acting like an ovary. It's aromatizing your testosterone to estrogen. Why? Hyperinsulinemia. Change your diet, Fabian. A low carb or no carb diet to lower your insulin level. Do intermittent fasting, and likely your testosterone level will come up on its own. Thank you, RM. I appreciate that. Sounds like the glucose formula in honey is the same as C6H1. Right on. Yep, chemical formula is the same in other words. Fabian says, my level of testosterone is at 400. What is your free testosterone? What is your free testosterone? I'm guessing that is your total testosterone. What is your insulin level? What is your liver function? AST, ALT. What about middle insomnia? I get up to go to the toilet. Why are you getting up to go to the toilet in the middle of the night? You're welcome, Fabian. I'm glad to help. I think I'm getting you to help yourself, actually. I don't know if I'm actually the helper. Mikey, is it good to fast at night? I think most of us who sleep at night are fasting. So the very fact that you go to sleep, you cannot be eating. If you're sleeping, you're not eating, and that is referred to as fasting. Okay? Fasting, when we eat, the things that we eat could stay in our system for 4 hours. Insulin, when, blood sugar goes up, insulin goes up. Insulin in a not so insulin sensitive person could stay up from 4 hours to 10 hours. So in all reality, if you are insulin resistant, you might not even be fasting, even during an 8-hour sleep. I know it sounds crazy, but it is possible. Lowering your insulin level by lowering your carbohydrates is in your best interest. Is it true you should not eat for at least 12 hours? I need more. Should not eat for 12. I'm not sure what the question is. Fabian says, I need more people like you, Doc. Well, that could be true, but I think you, by asking the right questions for you, can actually help you. You need to be more in charge of your healthcare. Speaking of fasting, it goes up. What if it goes up when eating? If what goes up when eating? Would fasting for 24 hours on alternative days help my PCOS? You have to be sad. You have to be very careful. If your insulin level is elevated, when people try to fast, when they have hyperinsulinemia, they get hungry. So you might be able to make it 24 hours, but how do you end your fast? Do you eat the exact same foods that caused your PCOS in the first place? Because that would probably be the wrong thing to do, okay? I don't suggest my hyperinsulinemic people start off with fasting because you set them up for failure. That's my thought process. Sola, the reason women at menopause or postmenopause have facial hair is unopposed androgen, the inability for the androgens to convert to estrogens. And I would tell you that a lot of that is from adrenal problems. When we consume saturated fat from animals, saturated fat and cholesterol help us to make pregnenolone. And pregnenolone tells the adrenal glands to make DHEA. This is after menopause, okay? After your ovaries kind of shut down, you can still make estrogens. When the adrenal glands aren't functioning great, they don't make as much DHEA because DHEA is needed to make androstenedione. Androstenedione is needed to make testosterone. And then testosterone is supposed to aromatize to estrogen. But if insulin is too high, that problem is not working, or that part of your system is not working. And so you get a buildup of androgens, thus androgenic side effects. Okay? So first off, am I no longer live on IG? I am. It says I'm live. Yeah. It says I'm live, Lucy. I don't see any questions over there, though. And the ones I do, they're not appropriate. So, all right. Hopefully that answers your question. Oh, 1910 says, finally I got my insulin checked. It was 2.7. Awesome. Good. All right. Oh, well, Lucy, I saw that you were on over there on IG before, so I'm not sure. You hopped over to YouTube. I'm live on Instagram and YouTube, but I did see you over on Instagram. I don't know when it was, but it was a while ago. All right, you guys, we've been talking a little over 2 hours, and we will call it quits for now. And like I said, I am live every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. So Lord willing, I will be back live on Instagram. Thank you for that, Tyler. I appreciate the gift. I appreciate all of that. It means a lot to me, and very generous as well. But I will be live again tomorrow, Lord willing, at 10 a.m. Central on both Instagram and YouTube. So join me. If you can right now, make sure that you've hit that thumbs up. Make sure that you've hit the subscribe or the follow button, and share it. Share this live stream to somebody that you think might be able to benefit. I would appreciate that. And Angel, you're welcome. Thanks for being here. And yes, Lucy, I will see you tomorrow. And RM, thank you for my blue wrenchers. I appreciate you guys for being here and helping me out. It means a lot. So until then, you guys have a blessed Saturday. See ya.